I don't know if anybody noticed, but the greatest weapon that you can have as a dialysis patient is initiative, right? I don't know if anybody has been paying attention to my videos, but in a lot of my videos, there's this theme of self-reliance. If you're just waiting around, waiting for somebody to do stuff for you, it may never happen. You got to take the initiative to get shit done. For example, my access stopped working. Okay? So when I went to the hospital, I was there for 2 days and they couldn't get the graft open so I could use my access. They sent my referral out. And because of a clinical error, they filed my referral under the wrong insurance. So my referral just sat there for days until eventually I called them and let them know, hey, what's going on? Then as a result of me taking the initiative and calling them, they filed my referral under the right insurance, and now they're getting me in next week to see if they can like reopen the graft or see if they can save the graft. Like I said, initiative is the most powerful tool that a dialysis patient can have. Do not just leave it up to chance, and do not just put your fate in the hands of people who do not care about this as much as you do. You need some doctor's office to do this thing at this particular time, and and they just decide, oh, well, we just ain't gonna do it. Or this patient, he could wait. And then the longer you're sitting around waiting for them to make a decision, waiting for them to get their shit together, like, things could get worse for you. And that's not what you want. You have to exhaust every single fucking resource that you can in order to get what you need done. If you are on transplant, if you're a dialysis patient, if you're in a dialysis unit, if you're dealing with nephrologists, if you're dealing with this doctor, that doctor, sometimes you need to get on their ass for them to do their job, so that way you can do your job. As a dialysis patient, I'm going to say this. You should not have to deal with any more suffering and any more incompetence than you are already dealing with, right? Because dialysis is hard enough. You already work hard enough doing fucking dialysis, and the last thing that you need to do, the last thing that you should have to do is hold the hands of medical professionals who should know what they're doing and prioritize their fucking patients. Them taking care of you should not be an option for them. It is their job. And you need to take the initiative to remind them of that. And you need to take the initiative to remind them of that. Because if you don't say anything, nothing gets done. Because if you don't care, they're not going to care. And if you don't care what you want, they're not going to care what you want. Now, because they couldn't get my access working, I have now gone 10 days without the use of my access, which led to the catheter, which I deeply, deeply despise, right? Because they're juggling around, well, who's gonna work on this access? UC Davis, hey, well, they just told me that, hey, we don't do Wednesdays, brother. So they turned me away. So I went to Sutter, right? And like, the right hand doesn't know what the left hand is doing when it came to that, right? So now, then that turned into a clinical error, and it's just like all of this bullshit that like I don't have to deal with. I should not have to deal with, right? But if I would have just been one of these patients that just is quietly, just politely, just waiting for, I'll just wait for them to give me a call. I do not do that. If you have something that you need expedited, then you need to let them know, this is what I need. And I need it either right now or I need it as soon as possible. It cannot wait. I cannot stress the seriousness of this fucking situation. Sometimes when you get on the phone with them, sometimes it just takes you just telling them, look, all right, who do I need to talk to to clear this problem. But you won't know that until you take the initiative.